The next region that we'll take a look at is the forearm and hand. This is chapter 3 in the Trail Guide to the Body text. The first muscle that we'll focus on is the brachialis. This muscle is located deep to the biceps brachii and is oftentimes forgotten about. We're going to activate this muscle by pronating fully the wrist and forearm into a pronated position, and we're going to ask Gina, can you bring your forearm up towards your shoulder? Good. And we can see that this muscle, the outline of the brachialis, is right here on the outside of the arm and on the inside of the arm here. This muscle originates from the anterior surface of the lower portion of the shaft of the humerus and then inserts into the tuberosity and cornoid process of the ulna. This muscle makes up the bulk of the front of the arm. We're going to flex the elbow and we're going to place the finger in between. We're going to first find the bicipital insertion and move just a little bit medial to that and a little bit deeper to that. And we're going to ask Gina, can you pronate and supinate your arm? And now supinate it. When you supinate it, we can see the biceps tendon protrudes, so we know that we're not on the biceps tendon. And what we're trying to locate is the insertion for the brachialis. And relax. So that's a good way to differentiate those tendons from each other. To palpate this muscle, once again we're going to put the arm in a slightly flexed position and we're going to lift the muscle belly up and we'll work our way up the arm until about right here. That muscle begins about right this portion of the lower half of the shaft of the humerus. Now let's take a look at this muscle on Kevin. We have the elbow in a flexed position with the back of the hand resting on the thigh, and we're just going to outline this muscle using just a flat palpation, strumming across the muscle belly of the brachialis as it makes its way down to its insertion point really close to the insertion of the biceps brachii. So let's have you pronate your arm fully, keep the arm to your side, now pull up, if you will, so we can see a distinctly different muscle contraction occur when we pronate the forearm. Now let's supinate it and pull upward. We can see the distinct muscle belly of the biceps brachii protrude here. Let's pronate so we can see the difference. Pull up. You can see more of the muscle fibers of the brachialis here on the medial aspect of the arm and on the lateral aspect of the arm. Now we're going to palpate the brachioradialis. This muscle originates on the supracondylar ridge of the humerus and runs down the forearm and attaches onto the styloid process of the radius. We're going to turn the wrist and hand into a neutral position with the thumb facing upward, slightly flexed. And Gina, can you bring your forearm towards your shoulder? Good. You can see the outline of this muscle. You can outline it right here, all the way down to the styloid process, and the other border of that muscle right here, down to its insertion point. And relax. The origin of this muscle is on the supracondylar ridge of the humerus, and it runs down and inserts onto the styloid process of the radius. This muscle is easy to palpate because it's superficial, and we're going to use a pincer palpation technique starting at the elbow at the supracondylar ridge, and we're going to work our way down towards the wrist, and about right here at this portion of the arm the muscle transitions into tendon, so we're going to use a flat palpation and we're going to strum across the tendinous attachment. We'll strum across the tendon as we make our way all the way down to the radial tuberosity, the styloid process of the radius. Now we're going to palpate the muscles of the forearm. We'll begin by locating the muscle called the brachioradialis. This muscle originates on the supracondylar ridge of the humerus, which I'm palpating here. This muscle runs down and inserts onto the styloid process of the radius. We're going to ask Christian to contract this muscle by rolling his thumb upward and then pulling with just kind of at the elbow there. Good. So we can see the brachioradialis muscle right here as we outline it. And relax. So this is a good muscle to use a pincer palpation technique. Locating the supracondylar ridge of the humerus, we're going to trace this muscle with a pincer palpation down the forearm on the radial side. We lose the muscle belly here. We'll use a flat palpation to strum across the tendon as it makes its way down and inserts into the styloid process of the radius. If he lifts his thumb up, we can see the two distinct tendons of the extensor pollicis longus and brevis. The tendon that we're looking for is in between those two. Now let's identify the attachment sites for the pronator teres. Here's the common flexor tendon and the medial epicondyle, the cornoid process of the ulna. This muscle runs across the forearm and attaches onto the shaft of the radius. We'll contract that muscle and identify and outline the muscle borders. Then we'll use a pincer palpation technique to lift and identify the respective muscle belly of the pronator teres as it makes its way to its insertion point on the shaft of the radius. The muscles and tendons of the forearm and hand are closely packed together. The ability to identify and locate bony landmarks is extremely important when trying to identify the respective muscle bellies and tendinous divisions of this complex region of the forearm and hand.